Smoking. Most of the time, it starts as a curiosity, a perception of fun, or a sense of belonging in peers. But before you know, it becomes a habit that's hard to break. People feel trapped in daily cycles of nicotine dependence and craving. Tobacco smoking is perhaps the most addictive substance. It causes many diseases and is a leading cause of cancer. Yet, it is advertised to attract you and designed to make you an addict. 2 out of 3 people who smoke want to quit, and some are brave to take on this challenge. Let's ask Dr. Smart about it.
Hi, welcome to Smart Clinic. Let's talk about smoking today.
Dr. A, why is it so hard to quit smoking?
Tobacco smoking is very addictive. When a person smokes, hundreds of toxins and chemicals enter the lungs and body. One of them is nicotine. It reaches the brain within a few seconds of the first puff and releases a chemical called dopamine. Dopamine gives the brain a feeling of pleasure and reward. After a few minutes, this feeling goes away. It makes the person restless and having an urge to light up another cigarette, and then another, and so on. This is how smoking becomes a habit that is hard to break. As the body gets used to nicotine, it needs more amount to have the same satisfaction. This makes person wanting to smoke more and more. Many people feel trapped in this repetitive cycle. When a person stops smoking, they may feel symptoms of nicotine withdrawal. They may get easily irritated, become restless, have headaches, constipation, and increase in appetite. These symptoms, however, go away after a few days and are usually gone in a month. 2 out of 3 people want to quit, but the physical and emotional addiction makes it difficult. Quitting can be tough, but it is possible. Nowadays, we have many different ways to help people quit.
Dr. A, how does smoking harm our body? And can the body recover if a person quits smoking?
Cigarettes contain many harmful chemicals. They damage our body in different ways. The effects of smoking depend on how much a person smokes and for how many years. It also depends on our genetics and gender. Starting from the mouth, it causes stains on the gums and teeth, and people lose teeth at an earlier age. The ability to smell also gets affected, and the food feels less tasty. Smoking also damages the protective layer inside the nose and sinuses and lungs. There is more mucus and frequent infections of sinuses, throat, and lungs. Smoking can lead to a chronic lung disease called COPD. It happens due to thickening and tightening of air tubes and damage to the air sacs. This makes breathing difficult and day-to-day life gets affected. To learn more about it, watch our video on COPD. As soon as a person smokes, their heart rate and blood pressure increases. Over time, smoking causes blood vessels to become narrow and thicker. This causes hypertension or high blood pressure. There is also more chance of having blood clots. With damage to blood vessels and more clotting, there is a higher chance of having heart attacks and stroke. Smoking is the most common cause of cancer. There are more than 100 cancer-causing chemicals in a cigarette. These toxic substances damage the DNA inside the cells, leading to cancer mutations. Smoking increases the risk of cancer of mouth, throat, lungs, bladder, and other parts of the body. Smoking also makes immune system weak, also causes weakness of the bones and sexual dysfunction. The good news is that when a person quits smoking, many of these problems and risks can be reduced and some can completely go away over time. The benefits of quitting start as soon as the person stops smoking and will continue for the rest of their life. Just 20 minutes after the last cigarette, the heart rate and blood pressure starts to drop down to normal. Within a day, the amount of carbon monoxide in the blood gets back to normal. 1 month after quitting, cough and breathing starts to get better and continues to improve throughout the year. The sense of smell improves and the immune system starts getting stronger again. In 1 to 3 months, the risk of heart attack starts declining, and after 1 year of quitting, the risk is reduced by half. During the next 5 to 10 years, the risk of stroke and heart attacks continues to get lower and lower to the point that it reaches the same level as if the person never smoked. Also, in 5 to 10 years, the risk of all smoking related cancers reduced to less than half. Apart from the benefits to your health, quitting also has benefits of you saving money and keeping people around you safe. Remember, it's never too late to quit.
Dr. A, what are effective ways to quit smoking?
Quitting smoking is challenging, but it can be done. Many people want to quit. It may take more than one attempt to successfully quit, and that's okay because each attempt is bringing you closer to the goal. We now have many ways to help you succeed in this journey. Here are some tips to manage nicotine withdrawal and get rid of the habit of smoking. Number 1. Ask yourself, why do I want to quit? Having a clear purpose and a reason to quit will help you stay motivated. Some people want to enjoy their life better or stay healthy. Some want to do it for their kids or someone else who they really love. What's your reason? Number 2. Replace smoking habit with something else. This is especially important at times when you feel the urge to light up a cigarette. Find out what triggers you. A trigger could be a task or an environment that prompts you to smoke, such as driving, talking to a friend, after meals, or so on. List down your triggers and try to replace them with something different. Remember, this strong urge will go away after a few minutes, so keep your mind, your hands, and your mouth busy during this time. Better choices are to get busy by drawing, play a game, chew a gum, biting on a straw, eating a healthy snack, or calling a friend. Number 3. Tell your family and friends that you are quitting so they can support you and understand your challenge. Include them in your journey to freedom. Number 4. Set a quit date. You are more likely to succeed if you set a date for quitting and make an effort to stick to that date. Number 5. Use medicines to help quit. You are 3 to 4 times more likely to succeed this way. One such medicine is called Chantix. Medicines help you control the symptoms of nicotine withdrawal, improve your mood, and reduce the craving. Another option is nicotine replacement therapy. Nicotine patches give a small amount of nicotine to the body for helping with withdrawal symptoms. And then when you have the urge to smoke, nicotine gums, sprays, or lozenges can help you in those times. Other medicines and methods are also available. Discuss with your doctor or smoking cessation expert which medicine is right for you. And lastly, keep in mind that it may take more than one attempt for you to quit. So don't give up, don't lose heart, and keep trying and seek help. Every cigarette you avoid is saving you and the people around you. There are helplines and local clinics available to help you in quitting. Do not hesitate to call them and get support you need for this success. And once you quit, become a champion and help others in their journey.
You know smoking is bad for health, but it also costs lots of money and time. Most people start smoking before the age of 20. So if you smoke a pack every day for the next 20 years, it will take 15,000 hours of your life and a lot of money. In the US, it will be $36,000. Imagine what great things you could do with that much money and time. Remember, never start smoking, and if you smoke, it's never too late to quit.